Hello everybody, this is Dr. Yasin Tayem. I am MD PhD from the University of London. I am Associate Professor in Pharmacology and Therapeutics at the College of Medicine and Medical Sciences, Arabian Gulf University in Bahrain. In this video, I'm going to talk about Unit number 2, Problem number 10, how to write a complete outpatient prescription. Outpatient prescription is a prescription prepared by the physician for a patient following a visit to the outpatient clinic. For the medications to be administered correctly and to avoid potentially fatal medication errors, prescription must be written completely, that is, includes all components, and legibly, that is, clearly written and readable. How does a complete prescription look like? This slide shows an outline of a complete prescription. It starts with the prescriber details, then patient details, then date, then the main body of the prescription, which includes Rx, which means dispense, followed by generic drug name, then strength, then formulation, then quantity to be dispensed, then instructions, which includes the dose, route of administration, frequency of administration, and the duration of treatment. Then at the end we have to add information on refill, and then we have to sign. This is how a complete prescription looks like. It includes prescriber's details, including the name of the prescriber, his qualifications, his address, and his telephone number. Then, patient's information, including his name, his address, his telephone number. Then, patient's age. Then, the date of the prescription. Then we start with the main body of the prescription, which starts with the Rx, which means dispense, then generic drug name, then strength 500 milligram, then formulation, which is a capsule, then quantity 40 capsules. It includes also SIG, which means instructions for use. In this case, for example, take 1 capsule, that is the dose, PO, that is orally, the route of administration, frequency Q6 hours, and the duration for 10 days. At the end, we have to add information about refill. In this case, it's none. And then we have to sign. Is there a smart way to check the completeness of my prescription? You can use the following rubric to check if all components of the prescription are written. The first one is Rx, followed by drug generic name. Then strength, formulation, dose, route, frequency, duration, quantity, and instructions. So if we look at the following rubric, it should include Rx, drug name, then SFD, RFD, QI. Now let's move on to practice. Write a prescription for the following case. Ahmed is a 35-year-old man who presents with fever, facial pain, and headache. The pain gets worse when he leans forward. The diagnosis of acute bacterial sinusitis was made. Write a complete prescription for this patient. This slide shows a complete prescription for Ahmed. Notice the components: prescriber details, patient details, age and date. Then the main body of the prescription, keeping in mind that augmentin is the drug of choice for acute bacterial sinusitis. Rx, augmentin, 500 mg tablets, 20 tablets. Take 1 tablet, PO, Q12 hours for 10 days. Refill, none. And then we sign